I want to thank everybody for joining us today. I'm Peter Dickinson, DAB Senior Executive Advisor, work in the National Service Legislative Headquarters in Washington, D.C. With the legislative team. And I'm here to present a presentation and have a discussion about the Department of Veterans Affairs FY 2022 budget. We will do a presentation for about 10 or 15 minutes with some slides. And afterwards, there'll be lots of time for questions and answers. So I'm going to go ahead and get started sharing my screen. And with luck, people can see a front slide that says Benefits Protection Team Briefing, VA's FY 2022 budget. As you know, the independent budget, which DAB is a member of, together with PVA, Paralyzed Veterans of America, and VFW, puts forward the independent budget each year, which contains budget. And we also do policy recommendations. We do them in two separate documents. We do the IB policy agenda for the 117th Congress, just came out in January. And then in February, we came out with the IB budget recommendations for FY 2022 and FY 2023. We put this out by February 1st. That's when the budget on the federal budget is normally due, according to the law. It is due the first Monday in February. However, what typically happens when there is a new administration is that the new administration takes some time to get the budget recommendations that they have rather than the prior administration. So it's very typical that that comes out later. But we release it on time. We want to make sure we both reinforce that point, but also we want to be clear it's an independent budget. We're putting out independent recommendations we develop through our own methodology, looking at baselines, looking at a lot of factors, inflation, increased workload, and so on. And this year was a little bit different. We had to really have to look at the assumptions that go in because of the impact of the COVID pandemic, which of course essentially froze healthcare, except essential healthcare, for a time period, and really inhibited and hindered healthcare for an extended time period beyond that. So there's a lot of uncertainty about whether there would have been more enrollment, whether the utilization, how much lower would it be this year, and what would that have as an effect next year? What would the reliance, how much would veterans look to VA after the last year? Inflation is something that's a little bit more variable, a little bit more unstable compared to the prior 5 or 6 years. And of course, unemployment, how quickly would that come down? What would the impact of that be? So there's a lot more variability. We had to make some assumptions, and that's all described in the report. Now, the VA did put out its full budget request at the end of May. You may have heard something they talk about. They put out what they call their skinny budget earlier in the spring, which is where they talk about some of their top line numbers. What's the total amount they're going to look for VA? But the actual full budget document is available on the end of May. There's a number of volumes. At the end of this presentation, there are links to all of these documents. And as I've said, all of these slides will be available for download on DAB's Benefit Protection Team portion of our website. Now, to understand VA's 2022 budget, it's a little bit different than in prior years because there's usually two components for the budget. As I think all of you know, thanks to DAV primarily and other VSOs, VA's medical care budget is done through advance appropriations. So that's done a year in advance to make sure that the VA healthcare system runs it uninterrupted. And that was done last year. And so VA has essentially enough money to run the healthcare system. But they also get a second bite, as they call it. So when they come back, they passed it last year, and that's the advance budget for next year. Now they come this year, they get a second chance to increase some of those amounts. And of course, With that second bite, there is, of course, the first bite or only bite for all of the rest of the programs, from VBA to IT to National Cemetery Administration. This year, there's 3 additional sources of funding that make up VA's total resources they'll have available in FY22, which begins October 1st of this year. There's some leftover money. When VA doesn't spend funds, they expire the authority to use those. So normally they have 1 year. Some funds have 2 years they can spend it on. And that money would either revert back to the Treasury, or they could ask for the authority to transfer it. Well, they created a couple of years ago what they call a recurring expenses transformational fund, which allows certain funds automatically to be available after they expire from the first year. And so there's about $820 million that will be part of next year's budget. In addition, there is the COVID relief funds. In this case, there's been 2 big bills. One was called the CARES Act, passed last year. That money will essentially have been spent down by the end of the FY21 fiscal year. But there was a second bill when President Biden came in that they put forward called the American Rescue Plan. And that contained over $17 billion for VA, primarily healthcare, some for VBA, some for IT, and some other areas. That money will be available next year. It is a big supplement to the VA budget. So as we go through, you'll see how that affects it. And there's also, it is far from being passed, but there's a proposal, this infrastructure proposal, which has a chunk of it that would go to VA hospitals and clinics and facilities. And we'll talk about that. That's far from certain, but it may be available. So jumping down, the biggest part of VA's budget is, of course, medical care. The total medical care budget for VA, the IB recommended for the first time over $100 billion. That includes both VA provided care as well as the care in the community that VA doesn't provide through the Mission Act primarily. So we had that as an 8.3% increase over the current year we're in. Now, when the VA budget request, the full request came out, it was honestly a very strong budget. We've said in our testimony that if it is enacted along with the additional resources, that it's the first time we could say VA would be fully funded, with some very small little minor deviations. VA would be fully funded next year. So that would really be a change over what it typically is. VA's request in their budget document, that is new funds they want, is $101 billion. And that's a little bit less than we asked. And then the very big, however, VA has $14.5 billion. This is the COVID relief passed this year to go to VA medical care. And that will cover, let me talk about, I'm talking in context in the next slide. And let's talk about how it impacts VA's provided medical care and then medical services provided through the community. So for VA, the portion of the VA provided care, we recommended $81.4 billion. VA's request was lower, but again, for VA provided care, they have $12.5 billion from the American Rescue Plan. Now, part of that is still covering things related to COVID, people who got COVID, they have extended problems, they have greater needs. It's also to cover the people who deferred care, who didn't get the care over this year and part of last year because they didn't want to do in-person visits that weren't urgent. And so they expected, and we expected, and built this partly into our budget, maybe not to the same degree, that there would be this care that wasn't done, but they'll do it more starting in October. So that will eat up a lot of it, but there will be significant extra dollars if this amount is appropriated, the new money. Now, part of what we wanted in our recommendation was that VA would really start hiring to fill the vacancies we've been hearing about. We were, I guess, modest, or we thought it was looking for 10,000 or so new employees. We thought that would be about between a quarter and a third of the vacancies, so that they could fill the vacancies over a couple of years. VA's actual budget requests would add over 17,000 new employees. So again, very strong budget, really trying to dig into the demand for healthcare. And there's a reason why we need to hire some more. And it's partially because of one of the primary reasons you need community care, non-VA care, is people can't get in VA, right? If you have to wait too long, that's because VA doesn't have enough providers or enough space to provide the care. So part of that hiring is designed to allow people to get the care from VA and to come back into VA. Now, our budget estimate for the community care was a little over 20 billion. It was an increase from the prior year. And again, we did expect it to go up also, people deferring care in the private sector. And what we've seen is that VA's request is much larger for the community care. Now, part of that is they have better numbers and data on both how much care declined. They also put this out 3 months later than we did, more than 3 months, almost 4 months. So they've got even more updated data on the number of people coming back now starting to get care. And so they're seeing, again, a large swell of people, a large increase coming back to VA. And if VA can't provide it, they need to look to the community because of the Mission Act putting new access standards in. Ignore this error below. It says plus 14.5 billion. I'll correct that on the slide in the handout. For community care, there's 2 billion extra. So it's still a significantly larger number than we estimated. But we've talked with VA, Congress has asked VA, and we're confident this does not represent a shift of trying to move care out of VA. It represents mostly a growth that was expected to occur when they created the Mission Act and the new community providers. They only really filled in their networks last year and this year. And so we're starting to see that uptick from people who now can use the community care. And it's a big swell up of this deferred care, which VA cannot rapidly stand up additional capacity. They can't onboard people overnight to meet a big increased demand. So there'll be a big push up in community care is what VA is anticipating next year. Starting now, it's already happening, but it'll continue. So the VA medical care budget, if approved anywhere near as proposed, when you count the additional money from the COVID relief, is going to be an extremely strong VA healthcare budget. And our focus now is to make sure they're spending that money well and properly. And as I'll talk in a minute, that they've got the facilities and the IT to really make that work. I'm just going to touch on a few of the other places in the budget that are significant and some of the trends that I see. And then we'll talk a little bit more about where we go from here. So for research, very important. Again, VA doesn't just provide healthcare. We know one of their important missions of the VA healthcare system is the research, which helps not just veterans who have disabilities and illnesses related to their service, but the entire American healthcare landscape. The IB did reckon a very strong increase, over 10%. We did within that target some money additional for women veterans research to make sure that it's gender specific in a lot of areas. VA's request was also a big increase compared to what typically comes out. Not quite as high as ours, a little below, but a very strong one. This is one of the ones that we'd love to tweak up a little bit during the appropriation process. And part of their focus that they've identified is additional research on TBI related to COVID still, and toxic exposures. They're trying to put some more efforts into that, which of course is a critically important issue. So VA research looks to have a good budget start. Again, I think we've learned from COVID how important being on the cutting edge of research and therefore treatments is to not just veterans, but to the whole American population. So switching gears on the benefit side at VBA, we had, again, a big increase recommendation, 12%. We're looking for 1,000 new employees, primarily because the backlog, which had been growing even before the pandemic hit, grew a lot quicker during the pandemic. For a number of reasons. Again, veterans not coming in, not having the ability to do in-person examinations, been problems with the record center to get personnel records, which seem to have been resolved according to testimony last week. But the backlog has grown. It was only about 70,000 pre-COVID. It's up to 190,000 today. So that really needs to be dug in on. Now, VA's request, again, their straight request for new appropriation dollars is less than ours, 3.4 billion, but they do allocate 272 million from that COVID relief package, the American Rescue Plan. So combined, they are just a little bit higher than what we recommended. So that's good. We're a little still discussing with them why they only project a little over 400 new employees. We looked for 1,000. Now, part of that was not just on dealing with the claims backlog. There were some other small items like staffing up the call centers to help reduce the wait times there and to deal with a growing number of FOIA requests, Freedom of Information Act requests. So again, strong budget. VBA knows they're under the gun to bring down that backlog. We're working with them constantly, and hopefully their plan will address that. Similarly, the Board of Veterans Appeals, we had a big increase, 14% over the current year, 200 new people, primarily veteran law judges and attorneys. Again, VBA also has seen not just a rise in workload, part of it's still coming from the Appeals Modernization Act changes of a couple of years ago, but also that hearings became more difficult. There was some interruption with that, although VBA, the board, was doing a lot of video hearings. What they've really done to try to address this is do all sorts of virtual hearings now. You can do a hearing and our service officers can join on your PC, over the phone, I believe, on your iPhone, on a tablet. So there's a lot of ways now that they're really trying to address this. But again, veterans still have the right to want to have a hearing in person before the Board of Veterans Appeals primarily. And so the number of hearings over the last year has grown. The board is aware of this. Again, we have conversations, Shane does, Jim Marszalek, a National Service Director, to make sure they're really working to bring that down. We know they're focused on it. They did put in a big resource request, $228 million. Again, more than we thought they needed to do this. Oddly, they seem to have asked for some smaller number of people. And we're not sure what the difference is, but it's close. Again, the important thing is the commitment that they know they need to drive down the people waiting on hearings and continue to let the Appeals Modernization Act work as it's supposed to. Big dollars are spent, and it is extremely important that VA has modern IT and that it is maintained, and that VA employees have equipment capable of letting them perform their jobs using this modern IT systems. We asked for an increase up to $5.2 billion. VAs came in less with their new dollar appropriation request, but again, they have $670 million from what they call this recurring expenses transformational fund. So when you combine them, they're up almost to $5.5 billion, over a 12% increase. So they do also appear that budget request, if approved, would be a very strong budget. Now within there, we did, however, make sure that we want to identify some areas that are often neglected. The IT budget usually goes heavily in favor of the veterans healthcare system, and that makes sense. That's where most of the employees are, and all of that requires modern IT. But we identified that there's a number of IT projects that have been waiting for years at VBA to modernize. And so we asked them to please focus at least $175 million more on these VBA IT projects, including some that allow our service officers to work more seamlessly with VA. DAV has jumped headlong into filing electronic claims. We've been the leader on this for a couple of years now, which turns out to be a great advantage when you consider the past 15 months. We were ready to make that switch without skipping a beat to file all of our claims electronically. But there is still projects to modernize the workflow and process that VBA uses, the way that they're digitizing documents. We also at the board want to make sure they get additional funding. Their case flow system that they use to manage their workload, the use of artificial intelligence to sort through electronic documents. There's a number of items and we wanted to target that. And we also wanted to make sure that the VA research program had also cutting edge IT software to go with their research, and we targeted a little bit more money there. So even though the budget request may be higher from the administration, we need to work with them to make sure that it is also going not just to the healthcare system, but to these other priorities. The other big part of this IT is the electronic health record modernization. This is a huge project, of course, as we know. It's 10 years project contract with Cerner. You may have heard that name before. Almost $15 billion, $11 billion for Cerner plus VA has work. So it's a huge project to create an electronic health record system that will work with VA in a more modern setting, work with DoD, allow seamless access between seamless translation and seamless delivery. Also need to connect in not just VA hospitals and clinics, but the private sector providers. Our recommendation for next year was about $3 billion. It's a hard number to estimate. We rely on what we think they're going to do in terms of moving from, they've done this at 2 sites, one in Washington State, one in Ohio, and they're going to start rolling this out to more sites. Our estimate was about $3 billion. Which did include a focus on making sure you find a common scheduling platform that is truly modern electronic. Ultimately, we want to get to a capability to schedule appointments at the VA healthcare system, and if necessary in the community, the same way we do things like scheduling dinner reservations. Now, obviously, it's a lot more complicated, but why couldn't you open up your app if you know you need, it's time for your annual checkup, go onto your app, look what's available, where it's available, who it's with, and go ahead and lock it in. I mean, that's the long-term goal. So we want to make sure they're focused. Now, VA's request came in lower than ours, but there's a reason. Earlier this year, Secretary McDonough came in. One of the first things he did was meet with his team that's working on this. To make certain this project is on track. And there's been some concern, and you can imagine this large a project for IT is often going to find that there's potential waste, and there's potential problems sometimes that are hidden. So VA put in place a strategic review. The time frame for that is about up. They may extend it. The Secretary talked about this in a hearing this week. So this strategic review, which also slowed down their push to accelerate to new sites, I think is what the basis of why they've come in lower than we have. But again, they'll fund what they need to. Part of it's by contract. Part of it's for VA to make sure they have, things like the latest speed of internet delivery, so that they're not having slow internet, which is critical to all use of IT these days. And the last part of the budget that I want to talk about, which is extremely critical, is the maintaining VA's infrastructure. Now, for years, we've put forward recommendations from the IB that have never, with rare exceptions, been matched by either the administration, the VA, or by the House or the Senate. And that's regardless of which political party was in charge of the White House or Congress. VA has an enormous and yet aging hospital infrastructure They have a very large infrastructure of clinics. Many of them are not aging, but some of them are. A large number of leases, which require maintenance also. And so it's absolutely critical. Again, one of the reasons why you can't get an appointment in some areas of the country is there's not space to be seen. There's not space to put doctors and providers in. So our recommendation, trying to meet the size of the budget to meet the real need. You can see the numbers. We were at 2.8 billion for major construction, 800 for minor. This budget was higher than the last couple of years at 1.6 billion and 553 for major and minor. Still below what we requested, and this is a much more maybe perhaps. We know that the new administration has put forward a very large infrastructure proposal. There's negotiations. There's talk of reaching a framework agreement with a bipartisan group of senators. There's a long way to go on this process, but within there, this administration proposed $15 billion for VA hospitals and another $3 billion for smaller facilities and non-recurring maintenance. So if, and that's an extremely large if, those kind of dollars were available, that would make this an even stronger budget. That infrastructure money, the big dollars, 15 billion, would not be spent in 1 year. It would be spent over a number of years, but it would be an enormously large infusion. And so overall, as I said, almost every account, I haven't gone through some of the minor ones, not minor, but the less controversial, like the Office of Inspector General, the National Cemetery Administration. They've all gotten increases. They've all matched or exceeded what the IB recommended. So I didn't put them in this presentation. So what's next? Well, the administration's budget proposal is the first stop in the federal budget process. What's been happening since then is there have been hearings in the budget committees in the House and the Senate, hearings in the appropriations committees. As I said, the secretary testified this week before the Senate. The House and Senate appropriation committees will both put together their package of what the funding for VA should be, their appropriation bills. They will then work to pass them, then the House passes it, the Senate passes it, and they need to come to a conference agreement that can be signed by the new administration, by the president. So there's many steps ahead. The new fiscal year starts October 1st. Typically, that deadline is not met. And what they do is they pass a temporary continuing resolution. Certainly have every expectation that will occur again this year. But thanks to advance appropriations, we know that VA will already have their funding in place with an increase already. It won't be as big perhaps as necessary, but with the American Rescue Plan money, the COVID relief money, VA will still be in good shape, even if the budget process is late. Frankly, even if there is a showdown, as often occurs, whether over the budget or over the debt limit, VA should be fully funded. So we're in good shape there. There will also be an impact from what comes out of the infrastructure discussions and legislation. That will make a big impact, not just next year, but for years to come, potentially. So that is a critical area. One of the things that is ongoing now, as some of you may know, is that there is what's called the Asset and Infrastructure Review of VA healthcare infrastructure, via hospitals and clinics and other VA medical facilities, including research facilities. VA is going to come out with a report at the beginning of next year. A commission will be stood up to examine it for a year. The commission will put forward their recommendations in 2023. Congress will review it, the administration will review it, and ultimately Congress will determine whether or not those recommendations go forward. This is not a BRAC. That's a very different process with very different dynamics. At the end of this process, no veteran should lose any access to the same care they're getting. They have to have exactly the same care or better. And we believe as long as it remains transparent and open, which is the way we fought to make sure the law was, and that they look at the real facts, that this will not, quite the opposite from being a reduction or closure. We believe this will call for an infusion of new funding. And that's certainly what the new administration expects from our conversations with them as well. The other big wild card is this toxic exposure legislation. In the last couple of weeks, including yesterday in the House, there have been bills that have been approved by committees to expand research, to expand healthcare coverage, to provide a concession of exposure, something we fought for, and to create actual presumptions. We're 20 years on since the beginning of the post 9/11 wars. We're 30 years since the first Gulf War. We know that there are healthcare impacts from burn pits, from other airborne exposures, oil well fires in the Persian Gulf, and yet, even though many veterans have gotten sick, some have gotten disability compensation, we're still waiting for presumptions. That legislation potentially could have a very large cost in VA benefits and healthcare, and a debate over that is starting to mix into the VA budget debate. And so the budget process will continue on through the year ahead. The toxic exposure and this infrastructure have put out that we're now starting to see some real, I don't think they're imminent dangers, but there is a different kind of conversation that has started in the last couple of months that we haven't heard for some years. Talking about when will the VA budget be adequate, that it's grown too much when the veteran population is declining. When is enough enough? We can't continue to have these large budgets, rising deficits, the growing national debt. It doesn't seem like that conversation was occurring in the last several years, but it's certainly occurring now among some people. Now, no one has proposed any cuts or reductions. We haven't seen anybody take any concrete actions, but this is cyclical. This happens. And so we need to be very focused on this to remind people it's not the total number of veterans in the country, it's the total number of veterans coming to VA to get their health care, what health care they're getting, making sure it's the newest, modern, most tested, safe, and effective health care, and making sure it's timely. And that calls for these increases, and that the infrastructure is there. One of the concerns we have, and we've heard this conversation, and we heard it 20 years ago when VA was looking at its hospitals. Well, while we're reviewing what infrastructure we need, we shouldn't spend any money on VA hospitals or clinics. Well, that, of course, is a terrible decision. You know, there is still maintenance and repairs and renovations. There are unsafe facilities. And frankly, you know that no matter what this commission and Congress come out with, 90% of where VA is delivering healthcare is going to still need facilities to do it. So there are places where it's obvious we can spend it, and we need to make sure they continue to do it. And then the other argument that we've fought for years and years, and we continue to do, is what's called pay-go, which is that Congress sets rules on themselves that say, if we're going to increase spending, like if we wanted to create presumptions so that there is an increase in disability compensation, then we have to offset it with either reductions or tax increases. And the way the pay-go rule is applied, you have to do it from within the same essentially department or group of departments in the appropriations bill. So they come to us and say, we'd like to increase a benefit. Where can you find money to cut in VA benefits? Where can you find other places to cut benefits? And so you hear this expression, well, we want to give them benefits for toxic exposures, but how will we pay for it? As if the only source of funding has to come from other veterans. How did they pay for the wars? Frankly, how do congressional salaries get paid? They come from the general treasury. They don't come from just members of Congress. So we have a battle again to tell them, you didn't ask that pay-go be applied when you pay for the defense. You don't ask for it on many other bills, large bills. You don't ask for it sometimes on tax cuts. You waive it. You don't apply that rule. Well, when it comes to funding what veterans need and deserve, it's already been paid. They've paid their part. You've paid your part. Veterans have paid. What we need is that it needs to come from the budget, the overall budget. It is a national obligation. Congress's job is to make those decisions and those priorities to make sure they have sufficient funds, but you don't pay for it in the backs of veterans. So that's essentially a much longer, maybe deeper overview of where we are in the budget process. So let me please look and see if anybody has questions. If you do, or want to just talk about anything related, we've got others on the call. As I mentioned, I'm going to stop sharing this now. If you have any questions or want to make any points for us, please let us know. As I said, these slides will be maintained on the website at DAV's Benefit Protection Team website. So I'm going to thank you now. I'm going to stop the recording and I'm going to go ahead and take questions.